medicine for. Presenting Mr. G, a 26-year-old policeman who's come from Vellore, who's presented to us with complaints of fever for the past 5 days with left hypochondriac pain for the past 5 days. Patient was apparently well 5 days ago when he developed high-grade fever with chills and no rigors. This was associated with progressive worsening, dull aching, left hypochondriac pain, not associated with any change in worsening with any change in position. There's no history of any chest pain, palpitations. There's no history of any cough or breathlessness. There's no other bowel bladder complaints. There's no history of any headache, loss of consciousness, or altered mental status. On examination, patient was conscious, oriented to time, place, and person. Vitals were stable. There was no pallor, icterus, clubbing, cyanosis, lymphadenopathy, or pedal edema. There was eschar that was present on the left axilla. So actually, by the time the patient presented to us, the scab had fallen off. So, but there was an eschar on the left axilla. Respiratory system was relatively normal. There was trachea was central. There was equal movements in all areas with respiration, normal vesicular breath sounds. But abdomen showed a left hypochondral tenderness with no organomegaly. There was no free fluid. Cardiovascular and CNS examination was normal.
Just stop for a second. What do you think? What's your diagnosis? It's a clinical meeting, so you should try to make a clinical diagnosis. First the registrars and then the junior consultants. Registrars, you said something, I couldn't hear you, but. No, scrub typhus, yes, but why the left hypochondrial pain? Maybe scrub typhus. Why the left hypochondrial pain? What are you thinking of when there's fever and left hypochondrial pain? Yes, splenic abscess, what else? What else can happen to a spleen? But she said spleen is not palpable, no? That will have big spleen. And this is acute, whole thing is acute, no? Splenic infarct, endocarditis, all that, that's kind of things you're thinking of. Okay, go ahead.
So we made a clinical diagnosis of scrub typhus. CBC was within 12 HB of 12 with WBC of 9,000 platelets of 2 lakh 30.
Don't read out all the results, that people see them. Maybe just highlight the abnormal ones.
Yeah, so SGOT-PT was grossly elevated at 361 and 265 with an ALP of 118. An ultrasound abdomen was done from the casualty itself in view of the left hypochondriac pain, which showed a wedge-shaped hypoechoic lesion on the periphery of the spleen, suggestive of a splenic.
What clinical sign can you find? You may find with this. A splenic infarct. You may not also. Dr. Adarsh, you may get a rub. You may get a rub over the spleen if there's a splenic infarct. Go ahead.
So just looking at splenic infarcts and scrub typhus, there aren't a lot of studies done on it.
Okay, go ahead.
So we have a couple of literature review shows only 3 to 4 case reports on splenic infarct with scrub typhus. One of it is from our own college. This is a case report that was published in 2014 April which shows splenic infarct due to scrub typhus. So the conclusion, there was one case report of a 26-year-old gentleman actually who had presented with severe left-sided abdominal pain. But by the time patient presented to us, the fever had resolved and patient was over the period where the scrub positivity was there. So he had just come with complaints of left hypochondriac pain. On evaluation, on examination, there was a splenic rub that was present in this case. It was present. And a CT had done at that time for the left hypochondriac pain.
That's for this case or for your case?
No, for this case, the case report that was presented showed a splenic infarct that was there. So patients coming to us, it's a very clinical thing. Patients coming to us with, especially since we are in the scrub season that is going on.
The scrub typhus test positive?
Yes, positive. So patients coming to us in this period with left hypochondriac pain, though splenic infarct is not a very commonly seen thing, that is something that needs to be considered. So even in this case, the conclusion from this was based on the above study, it was concluded that splenic infarct is not a well-known complication, but it should be considered as a possibility. And the investigation of choice would be an ultrasound abdomen or a CT abdomen. So these are 2 other case reports from Safdarjung Medical College that is there regarding this. The pathogenesis for splenic infarct is similar to the rest of the organ injury that is there. There is focal and disseminated vasculitis that happens due to direct invasion of endothelial cells and phagocytes by the rickettsia or an immune response to the pathogen, which causes a subsequent vascular injury. So involvement of spleen per se has been seen only in 8% of the cases, predominantly causing splenomegaly, but there are only very few isolated 3 to 4 case reports of splenic infarcts per se. It can also subsequently cause a splenic abscess. Management is the same. There is nothing else extra that we need to do. Patient needs to be on doxycycline as azithromycin. That's what we continued our patient. Fever subsided. Patient is clinically better.
That was very fast. You finished in 5 minutes. Any questions? So we have time for questions. What are the other causes of splenic infarcts?
Splenic
Did you look up that
Yes.
cause of splenic infarcts?
So infections in general, there are other infections, bacterial infections that can present, even typhoid. There are 1 or 2 case reports of typhoid causing splenic
What's the
infarct.
most common? Do people with AF get splenic infarcts?
Emboli.
No, do they get? I'm asking you. Because AF can cause infarction in almost any area, in the limbs, in the brain. The spleen is a very vascular organ, you know. It's basically a bag of blood. You learned that. So I don't know. It would be interesting to review the causes of splenic infarcts, you know, and put that up as well. Anyway, thank you. What the next case from how's the patient? Discharged? How old was he?
26
Young man. So next case is from Medicine 5, Silent Storm by Dr. Shaktivel. Today looks like a day for silence.